On this Thursday night, new alarm in Quebec. That province's coronavirus caseload climbs by 1,000.
We need everyone to come and help out.
Who is answering the urgent cries for help? Plus, the new outbreak at a huge oil sands camp in Alberta. Why thousands in Michigan are defying stay-at-home orders. What could a safe and slow reopening of the economy really look like?
This shutdown has become one of total insanity.
Antibody tests under scrutiny, the hope they could offer, and the lingering questions, too. And where one small step can lead.
Thank you very much.
A salute to Captain Thomas Moore and his remarkable fundraising.
Global National with Donna Friesen.
Good evening and thanks for joining us. We begin tonight with the crisis in many long-term care homes in this country as they struggle to contain outbreaks of COVID-19. There are indications the number of deaths continues to be underreported, especially in Quebec and Ontario. Today, overall, Quebec recorded its biggest single-day spike in deaths. The number of people who died in Quebec jumped by 143 today. That brings the total to 630. An increase in part due to a change in the way deaths are counted and a closer look at the causes of death. Among them is a 44-year-old doctor, the first healthcare worker in Quebec to die of COVID-19. Across the country, there are some big regional differences. 997 new cases in Quebec, 514 in Ontario, 162 new cases in Alberta. That, of course, reflects only the people who have been tested. More than 1,100 people in Canada are now known to have died. Roughly half the deaths are in long-term care homes.
If the measure of a society is in how it cares for its most vulnerable, this pandemic has revealed the chink in our armor.
Quebec's premier put out a call for help in the care homes. About 2,000 doctors have responded. Mike Armstrong explains why help is needed so urgently.
It's likely to look strange, but in the coming days there may be military vehicles in front of Quebec seniors' residences. With a critical staff shortage network-wide, a patients' rights advocate says soldiers should be stepping in.
We need everyone well-intended to come and help out, of course.
Quebec has put out an urgent appeal for help from anyone with healthcare experience. But it's still struggling with more and more workers off with COVID-19, off as a precaution, or off after burnout.
We need thousands and thousands of people, not just a few hundreds.
Quebec's official request for military help was sent to Ottawa Wednesday night. Exactly when soldiers could hit the ground or what they'd be doing is still being negotiated.
We don't have details to offer at this moment on personnel or tasks because those need to be worked out, but they are being worked out right now.
Across the country, about half of all COVID-19 deaths have been in long-term care facilities. Quebec is the only province to ask for military help so far, but it's not the only one struggling.
Well, we haven't asked as of yet, but everything's on the table.
Canada's premiers and Prime Minister have a conference call Thursday night. Justin Trudeau says the issue of long-term care facilities is on the agenda.
It is impossible to imagine the anguish families and indeed our elders are going through in this situation. There is just so much fear, so much uncertainty.
Now, one of the measures Quebec is bringing in to supplement staffing has angered workers in long-term care facilities and many members of the public. The province negotiated a deal with specialist doctors. With elective surgeries on hold, they're not working. Well, that deal would pay them to work in seniors' residences about $211 an hour. That's in line with what they'd normally be paid, but several times more than the nurses and orderlies they'd be working alongside doing the same duties. One of the orderlies' unions calls it insulting. Mike Armstrong, Global News, Montreal.
Anyone who lives in close quarters with others is at risk, and that includes correctional facilities. Now, an inmate in BC has died, the first death linked to a federal facility. Correctional Service Canada says the inmate from the Mission Institution in BC's Fraser Valley died in hospital yesterday from an apparent complication related to COVID-19. The medium security facility has a serious outbreak. 54 inmates and at least 8 workers there have tested positive. There's also been an outbreak at an Alberta-based oil sands mine where workers live in extremely close quarters. 12 people who work at the Kearl Lake project, which is about 70 kilometers north of Fort McMurray, Alberta, have contracted the virus. Imperial, which owns the project in partnership with ExxonMobil, says it's enforced daily screenings of staff and physical distancing at work, but thousands of people work there, and many fly in and out of the camp. As Heather Yourex-West reports, health officials are working to contain the outbreak, but shutting down the operation isn't an option.
The work camp at Kearl Lake is designed to house thousands. They fly in from all over the country to work in the oil sands. Now, Alberta health officials say some of those workers have tested positive for COVID-19.
Alberta Health Services continues to work closely with the company to implement outbreak procedures at the site and to minimize any risk of transmission.
Imperial says it's enhanced cleaning protocols and has been screening employees for symptoms since mid-March. But even with physical distancing rules in place, the virus has spread.
Keep in mind, a lot of these people they're not even from Alberta. They get on planes, they fly back to Newfoundland or the Maritimes or BC.
The Alberta Federation of Labour is calling on the provincial government to limit the number of people at the camp to the minimum number required. Low oil prices have already led to a decrease in the number of workers here, but experts warn shutting down projects completely would be more complicated.
It would take weeks at least to plan and probably a month to implement all the shutdown procedures to properly do it. And it would take a lot of people, not the people who are there normally to run it, but a bunch of contractors to come in to shut the place down properly.
This is not something that we can take lightly. The enormous economic long-term risk of simply by fiat shutting down SAGD projects in particular could be devastating to the province for years to come.
And so the province is working with the company to mitigate the risks, hoping to contain this outbreak before anyone else gets sick. Heather Yourex-West, Global News, Calgary.
The federal government is expanding the criteria for the Canada Emergency Business Account, allowing more companies to qualify for loans. More than 195,000 loans worth $7.5 billion have been approved so far, but some businesses didn't qualify. So the threshold has been expanded to include businesses that spent a minimum of $20,000 and up to a maximum of $1.5 million in 2019. They'll be able to access interest-free loans of up to $40,000. The Prime Minister promises a program to help small businesses pay their rent, says that's coming in the coming days, and he was working with the provinces on that. And the supply of personal protective equipment is still being worked on. The federal government said today just under 300 million surgical masks have now been ordered, and more than 17 million have already been delivered. Of the 145 million N95 respirators ordered, roughly 800,000 have arrived, and 1.1 million are expected to reach provinces and territories this week. The government says more than 14 million pairs of gloves have reached those in need. Another 900,000 are on the way. And it says orders have been finalized for up to 30,000 life-saving ventilators. There's intense pressure in some American states, especially Michigan, to end the lockdown and get people back to work. President Donald Trump has been hinting at that. Yesterday, he mused about opening the U.S.-Canada border to non-essential travel sooner rather than later. The U.S., though, is still the epicenter of the pandemic. And today, Prime Minister Justin Trudeau said a significant amount of time is still needed before the two countries can talk about loosening any restrictions. Jackson Proskow reports on the pressure President Trump is under to reopen the economy, even as the death toll there climbs.
An anonymous tip led authorities to a New Jersey nursing home where the bodies of 17 residents were found piled in a tiny morgue. As COVID-19 continues its deadly march across the U.S., the staggering toll shows no sign of slowing. More than 2,400 people died in the past 24 hours. New York, L.A., and Washington extended stay-at-home orders until mid-May, ordering residents to wear masks in public. But the White House insists the time is right to decide how to reopen businesses and restart the U.S. economy.
My administration is issuing new federal guidelines that will allow governors to take a phased and deliberate approach to reopening their individual states.
A crippled nation is divided over what to do. In Michigan, people flooded the streets Wednesday protesting strict stay-at-home orders. The mayor of Las Vegas demanded businesses be allowed to return to normal immediately.
This shutdown has become one of total insanity, in my opinion.
Health officials insist it's still too soon for that next step. They want to see weeks of declines in deaths and hospitalizations and say more testing is needed to allow even a gradual reopening of society.
The capability of being able to test, identify, isolate, get someone who's infected out of circulation.
Even if the White House succeeds in convincing states to loosen restrictions, it's not clear the public will be willing to return to daily life, especially as officials warn that anything close to normal won't be possible until there's a vaccine available.
The White House guidelines released late this afternoon essentially leave things up to the governors to decide what's best for their individual states. They're told to monitor 14-day trends to see if there's a decline in case numbers and hospitalizations. They have to make sure their hospitals have room for a surge if case numbers start to rebound. Most notably, though, Donna, there is no suggestion that they implement wide, broad-based testing as the health experts have recommended. Donna?
Jackson Proskow in Washington, thanks. The speed and the scale of job losses in the U.S. is without precedent. 5.2 million Americans filed for applications for unemployment benefits just last week. And that means a staggering 22 million people have lost their jobs in the past month. Roughly 13.5% of Americans are now out of work. The United States has not seen this level of job loss since the Great Depression. Some places in Europe are gradually beginning to reopen. Coming up, why things may never get completely back to normal. Singapore is a cautionary tale. It seemed to have the coronavirus under control after aggressive screening of travelers, testing and quarantines. But now a new outbreak is underway. Singapore reported 728 new cases, the biggest daily jump. Most of them are linked to cramped dormitories where low-paid migrant workers live. Singapore has imposed a partial lockdown until May 4th and made it mandatory for people to wear masks outside their homes. Japan's prime minister expanded a state of emergency to cover the entire country. The measure takes effect Friday and lasts until May 6th. Every Japanese citizen will also receive cash payments of nearly $1,000. Japan has more than 9,000 COVID-19 cases now and about 200 deaths. Germany is one of the countries set to begin slowly easing some restrictions. Some schools will reopen in early May, but bars, restaurants, theaters, and religious services will remain closed indefinitely. Bans on large public events, including soccer matches, will remain until at least August 31st. Chancellor Angela Merkel says physical distancing is still required and masks in public are recommended, but not mandatory. Getting back to normal is what we all crave, of course, but easing the restrictions is just not wise as long as there is still no treatment and no vaccine for this virus. Yet plans are being made in Canada to slowly begin to tweak the new normal and ease some parts of the economy back into business, tempered by the worry it could allow COVID-19 to return as strong as ever. Eric Sorensen explains.
For 1 month, Canadian businesses increasingly shut down. Now the first pivot towards reopening. In Saskatchewan, tentative plans to allow certain businesses to open up with distancing measures as already practiced at grocery stores.
As other businesses may be allowed to reopen, they will be expected to adopt similar practices.
Saskatchewan, though, is not Ontario or Quebec, large provinces with continuing outbreaks of COVID-19. Some of the biggest employers in the country are hurting, but the last thing they want is a hasty return to normal.
I think the greatest threat to us today, aside from the virus, is a false restart of the economy. We cannot afford what some would call a W in our recovery, where we have a second shutdown.
The Europeans have been through the worst and offer a possible glimpse into our future. This store in Rome demonstrably disinfecting before opening up. Others take the temperature of customers. In Germany, they're measuring off safe distances in schools and shops. And in Denmark, elementary kids went back to school this week. But that doesn't herald a return to normal business over here. Think Major League Sports. Perhaps made for TV competition, but they're not going to fill the stands. The usual attractions are not coming soon to a theater near you or any place where crowds normally gather.
Keep in mind, we've seen the economy shrink by 5% in the first quarter, and it would have been more but for Ottawa's stimulus. And looking to the second quarter, it's expected the economy will contract 23% on an annualized basis.
That suggests a lot of businesses will remain shuttered, or that reopening won't mean wide open.
We're going to still have containment around how many people are allowed in stores at a time. Even after we have a vaccine, I still think that there could be some psychological scarring from the current environment.
For now, the business and epidemiological experts are in sync. Don't let a second COVID wave be a big wave.
That we would be able to deal with it without having to shut everything down again. That's the last thing we want to do, is release everything and then bring it all back.
What would be worse than the current economic pain is if it achieves nothing. Eric Sorensen, Global News, Toronto.
Still ahead, why antibody tests for COVID-19 may not be a game changer. One of the greatest hopes for easing our way out of our bubbles is antibody tests, blood tests that reveal whether we've had COVID-19, perhaps with no symptoms. That might mean we're immune and can safely re-enter the workforce. There are dozens of antibody tests on the market now, but no government is using them widely. As Crystal Gamansing explains, that's because what they can tell us for certain is still unclear.
People are clamoring to get these uncomfortable nasal and throat swabs. If the virus is active in your body, the genetic makeup should show up. If you've recovered, antibodies should be in your blood.
I saw that there was a test for antibodies. It was a very simple test.
Dr. Jean Carruthers is a cosmetic surgeon in British Columbia. This Canadian company and its antibody test caught her eye.
Something that we're all very interested in is getting Canadians back into their real world, but safely.
Dr. Carruthers, along with her colleagues, wrote to Canada's health minister advocating for BTNX. Health Canada has not approved the test. It's also not approved in the U.S. either, but it is being sold under the Emergency Use Act. In Europe, the company has a CE marking, meaning it meets European Union requirements, but that is not an approval.
Our applications right now in Canada are sales for Europe and the U.S. This is to laboratories and to healthcare professionals.
BTNX CFO Mitch Pittaway says orders shipped to the UK were for independent evaluations. UK Prime Minister Boris Johnson called these types of tests a game changer in mid-March, saying they'd be available soon. But the tests failed under scrutiny. The UK government is not currently using any antibody tests. The World Health Organization is examining a number of different tests, including the antibody test from BTNX.
No test is of any value if actually it's not measuring what it says it needs to measure. So you have to do a full evaluation.
Getting an accurate antibody test is complicated because people will have different levels of immunity, and it isn't known how long it lasts.
Given the severity of the situation, it makes complete sense that agencies like Health Canada are doing their due diligence.
That leaves us with swab tests to determine active cases of the virus. Crystal Gamansing, Global News, London.
From blow-drying your nostrils to drinking tea. Next, the myths about cures for COVID-19. Since this pandemic began, Global News has been taking your COVID-19 questions to the experts. Lately, people have been asking about claims health products and home remedies might be able to fight the virus. So our Jeff Semple asked experts to separate fact from fiction.
This online video, allegedly produced by a doctor, claims to have found a cure for COVID-19.
By simply breathing in hot air.
It notes the coronavirus SARS was killed by temperatures of 56 degrees Celsius. So it suggests blasting a hairdryer up your nose.
Take slow, deep breaths.
The method was even promoted by a government official in Florida as a treatment option for those without medical insurance.
This sounds really goofy, and it did to me too, but it works.
But health experts don't agree.
That sounds like a very dangerous thing to do. You might dry out or even burn the very, very sensitive membranes that are actually there in your nose.
Social media is full of questionable claims, ways to protect against COVID-19. from using sunlight to gargling vinegar to drinking warm water every 15 minutes.
Completely untrue and not based on any science whatsoever.
The sun's UVC rays can kill some coronaviruses, but only at concentrated levels produced by machines like this one used to sterilize smartphones at Toronto hospitals. And while drinking water won't wash out the virus, it does help to stay hydrated.
We do know that if your airways dry out, it is easier for the virus to get in.
The Twitter sphere is also teeming with tips on immune-boosting supplements and vitamins, such as echinacea and vitamin C.
So there isn't a specific supplement or medication that's going to make you immune or even proven to decrease the likelihood that you'll acquire the virus.
An Ontario company even received this warning from American authorities after claiming a herbal tea works well against coronavirus infections. But not all home remedies are hopeless. Some studies, for example, have shown that gargling with an antiseptic, like mouthwash, might help against a respiratory infection. And of course, scientists are just beginning to study what, if anything, works against COVID-19. In the meantime, regardless of the product or the promise, they're asking everyone to do their research and make sure there aren't any negative side effects. Donna?
Jeff Semple in Toronto, thanks. And that is Global National for this Thursday. I'm Donna Friesen. We didn't want to leave you tonight before we updated you on the retired British Captain Thomas Moore. He's the 99-year-old who has now reached his goal of 100 laps of his garden before his 100th birthday.
Inches to go, and there he is. Congratulations.
There he is. A military guard of honor lined his route today. He's now raised an astonishing £15 million, far surpassing his goal of £1,000. All of it going to those on the front lines of the British National Health Service. And he's not stopping. We salute you too, Captain Moore. Thanks for watching. Take care of yourselves. Bye-bye.